Can you try decoding these words? If you said wash, soap, and mask, congratulations, you are now a part of the pandemic. We have seen the peak of emergencies this past year. With the COVID-19 pandemic, we have had multiple Americans contract the virus. Over 500,000 Americans have passed away from this virus, and mental health issues have arisen significantly. However, there is a solution. Hi, I'm Sukish Kamesh. I'm from the Kingman Hawk 4-H Club. And today I'm going to be talking about pandemic preparedness. Specifically, what pandemic preparedness is, how we can stop the spread of a pandemic once it is in our world, and how we can get our community involved during a pandemic. So first of all, what is pandemic preparedness? According to the World Health Organization, pandemic preparedness is an integral part of preparedness to threats to human health caused by any emergency, such as the outbreak of any disease. Pandemic preparedness is a continuing process and a nation's responsibility to ensure that emergencies don't occur, and if they do, that they don't get out of hand. In fact, 16 countries have published revised national pandemic plans since the 2009 H1N1 pandemic. This goes to show that multiple countries are doing their part in mitigating national and at times global emergencies. Multiple states in the US also have their own plan to battle against pandemics and emergencies. The individual states can tailor their plans according to the needs of its people. For example, a state with a smaller population like Kansas may not need the exact same number of materials or help needed to control a pandemic compared to a state with a larger population like California. In fact, the Kansas Department of Health and Environment has set estimates for what an influenza pandemic might do to our state, and it includes 1 million cases, 500,000 outpatient hospital visits, 5,000 hospitalizations, and 2,500 deaths. Multiple countries were able to look back and take example from how the world dealt with the Spanish flu in 1918. Even some African countries are able to manage their outbreaks, since they almost deal with epidemics every single year and even had to deal with the Ebola epidemic 3 years ago. So the African people are comfortable listening to their experts and practicing what they've been told to do. You're probably wondering now, then why did the coronavirus pandemic in the US get out of control, even with a national pandemic plan and a state pandemic plan? The issue in the US was that back in March of 2020, the coronavirus was fairly new, and there were no studies suggesting that wearing a face mask would prevent the spread. However, as the number of infections increased, the National Institute of Allergies and Infectious Diseases, headed by Dr. Anthony Fauci, and the CDC, headed by Dr. Robert Redfield at the time, were able to inform the American people that wearing a face mask does prevent the spread. Although many Americans began to wear masks at this point, some of us still do not believe in the idea. Even asymptomatic people can spread the virus to more vulnerable people. Things got out of hand when some of us did not follow the social distancing guidelines. It is inevitable that we trust science and listen to the facts of top doctors across the globe. People's cooperation is a mandatory part of pandemic preparedness. In fact, according to an article written by Healthline.com, we could have saved over 130,000 American lives if we all would have worn a face mask and followed the social distancing guidelines during this pandemic. However, it's not too late. We can at least do our part starting today by wearing a face mask and following the social distancing guidelines until the pandemic is over. Now we also have the option of taking the COVID-19 vaccine, but many of us are scared to take the vaccine. Only a very few number of people have had severe anaphylactic reactions to the vaccine. And these people have had a documented history of allergic reactions to drugs and other medical products, foods, insect stings, and other vaccines. So it is our duty that we take the vaccine and protect these less advantaged people from the virus. In fact, according to an article written by the New York Times, Dr. Fauci claims that when 75 to 80% of the Americans living in a community take the vaccine, they will be able to achieve herd immunity, which is the only safe way for the whole community to develop immunity against a specific virus. With any emergency situation, there's a lot of stress built up upon a single person or community. According to a Medscape survey taken before COVID in 2020, 42% of physicians reported burnout. You can